One of the things that can be confusing when you are trying to read about the mechanics of the human body is that not every source uses the same terminology. And moreover, not every source even thinks about a given joint or set of joints in the same way. So in this video, I want to clarify a few things about the ankle joint complex and introduce you into two different ways of thinking about this joint complex that you may encounter. The question that the issue at hand is really this. Is the ankle joint one joint? Or is it really two joints? So let's talk about this idea. First off, what I have here is an illustration of a physician palpating one of the axes of rotation of the ankle. The technical name for this is the talocrural joint. It's like where the tibia and the fibula as well sit on top of the foot. And this joint is what allows what at other joints we would refer to as flexion and extension. And at the ankle, we refer to it specifically as dorsiflexion, which is like toes up. So that's going like this, toes up. And plantar flexion. That's rotating down like this. So when you contract your calf muscles, you are plantar flexing your foot about the talocrural joint. The talocrural joint is a 1 degree of freedom hinge joint. Degree of freedom hinge joint. So you can just spin about this axis, right? That's fine. So this is dorsiflexion and plantar flexion of what when I normally say ankle, I'm referring specifically to the talocrural joint, and so I'm referring to dorsi and plantar flexion about that. Now, here's where things get a little tricky. There is another joint in the foot. I've talked about it a number of times. It's called the subtalar joint, and that is a joint between the talus, which is the sort of top of the foot bone up here, and essentially the whole rest of the foot. So you've got the tibia comes down, it sits on top of the talus, and then you've got, to a first order approximation, the whole rest of the foot down here, including the calcaneus, which is the heel bone, and all the bones up here. There's a joint between the talus and the rest of the foot, which you will hear referred to as either the subtalar joint or as the talocalcaneal joint. So let me write that down in a different color. Let me write down subtalar joint, also known as talocalcaneal joint. That's a joint between the talus, which is this thing right here, and then the calcaneus, which is the heel bone. Now, this is also, to a first order approximation, a 1 degree of freedom hinge or pin joint. The problem is it comes off at a goofy angle. And let's see, do I have a picture of that? Sort of. I think I showed this in a previous video. So it comes off, the subtalar joint, axis of rotation, comes up like this. So you can spin about that axis. You can spin like this, and you can spin like this. Now, the other part where things get confusing is how we talk about motion about the subtalar joint. This is generally unique to different fields. So podiatrists talk about this in a different way than biomechanics or biomechanists, which may be different than how physical therapists talk about it. But if we're talking about rotation about the subtalar joint, and let me just draw it like this. So this is like sort of like comes out of the foot. Another tricky thing, by the way, which we'll talk about later at some point in this class, certainly, is the fact that the specific orientation of the subtalar joint is highly variable from person to person. So your subtalar joint might be coming out more like this, whereas mine might be coming out more like this. But that's a topic for another day. how do we think about spinning about this joint? Well, here's the terminology, and let me go down to a figure that, well, let's draw it. Let's draw a rear view. So we're going to draw a rear view of the right side of the body. So this is be the lower leg. Here's the calf muscle coming down into sort of the Achilles territory, and then foot's gonna flare out at the medial malleoli, and then we've got the heel down like this. So this is a rear view. So the ankle joint, meaning the talocrural joint, that's oriented like this. And the subtalar joint is oriented kind of like this. So it sort of starts here and goes kind of through the ankle. Again, this is the back of the foot. So if you're wearing shoes, kind of the back tab of the shoe would come up like this. If we are spinning, well, here's a useful example. Here's something that happens. Here's a rotation that is clinically important that happens about the subtalar joint. Spraining your ankle, right? Say you step on a curb like this and you sprain your ankle by spinning it like this. Quite often, this is the most common way people sprain their ankle. This rotation is called inversion. And you've probably heard of an inversion sprain. Rotating the other way, so rotating like this, rotating like this, something that might be achieved if you were wearing, let's say, a running shoe with a wedge here. This used to be a popular idea. Like you put a wedge in the shoe on the lateral side, and you would force the shoe into a more everted, or let's just say eversion. There we go. That's rotating this way. It's possible, by the way, to sprain your ankle in the eversion direction too, and those tend to be more serious and take longer to recover from. Sometimes some people will use pronation, the motion of pronation, to collectively refer to both of these, or to refer to, pronation will refer to this. Pronation will refer to eversion, and supination will refer to inversion, meaning spinning like this. And even worse, some people in usually clinical fields have a different set of terms here. They will use Varus and Valgus to mean rotated in the eversion or inversion directions. Now, these are important terms to be familiar with, but to be honest with you, I always have to Google, especially Varus and Valgus, because the terms that I use, the terms that I feel that are the most clear are inversion and eversion, to refer to rotation about the subtalar joint. And you can think about spraining your ankle being like an inversion sprain. So that's how I'm going to talk about it in this class, and I only expect you to know inversion, eversion, meaning rotations about the subtalar joint. So let's think about it on this actual picture here. What direction would inversion be? That would be like a spraining your ankle, so that would be like spinning it like this, right? That's inversion. And then eversion would be spinning the other way around. Now, I wanted to bring all this up, first to emphasize this dorsiflexion, plantarflexion, and then inversion, eversion terminology, but also because sometimes you will hear people say ankle joint, and they mean the whole set of both the talocrural and the talocalcaneal joint together. So quite often people think about the ankle as being able to move freely, but I prefer to think of it as really two separate joints. each of which has 1 degree of freedom, because that helps us separate the motion about the talocurl joint, the dorsiflexion plantar flexion, from the inversion eversion that happens about the subtalar joint. And again, I pointed this out before, but the confusing thing about the subtalar joint is that it is not oriented in any of the planes of motion. I know I've drawn it like kind of slightly oriented in a plane of motion here, but it's not at all. So rotation about the subtalar joint is not a strictly sagittal, transverse, or frontal plane motion. Just like the wrist, we had these kind of weird, goofy movements. Same thing at the ankle. So I just wanted to bring this up because I prefer treating this as 2 separate 1 degree of freedom joints. That is maybe not even the most popular way to do it, and that's maybe not even the way you'll see it in most textbooks. Most textbooks will treat the ankle joint as a full set of both of these together. But that's generally how I will talk about it, and hopefully that can clear up some of the confusion about the weirdness that is the ankle joint.